and thank you to the AO, Community Development and Norm for putting on these members-only sessions. And I think they're nice sessions because we're sort of talking about topics that are a little bit different. We're not just talking about front versus back, conservative, surgical. They're kind of different topics along the way. I'm a neurosurgeon and I'm a wolf in sheep's clothing. I work in an orthopedic practice as their main spine surgeon. You can tell by my accent, I'm a local. I'm in Reno, Nevada, which is about an hour's flight from here. I'll try to give you a little bit of insight on social media and branding. That's something you won't see very often by an American surgeon. I have no financial relationships to disclose. I don't consult for industry. What I do want to disclose is that I'm fairly active in social media, and I have a blog, I have a couple of a Facebook site, LinkedIn profile, Twitter, a couple of things that are out there. If you type in Google and put my name in, you'll probably start to see some of those as well. This is the traditional view. This is what we all work towards. And my generation, which is not the generation of the other two panel members, we looked at our resumes. We did fellowships. I did fellowships. I've been in practice for 20 years. I did PhD. Somewhere along the way, I did an MBA. I've done about 10,000 cases, published a lot, teach a lot. But you know what? Patients don't really care about that anymore. And that comes as a shock to some of the more mature participants in the audience. But they don't really care about our resumes anymore. And our referrers don't care as much anymore. When I went into practice, this is what I was told. Number one, you've got to be available. Number two, you've got to be affable. You've got to be likable in order to get referrals. And the last one on that was your ability. And a lot of times, as you probably gathered, our referring doctors don't really know about our ability. But if you're available and you're nice, these were the keys to developing a good practice. But even this has changed now. So where do our patients come from? And this is a little bit Americocentric, and we'd have to adapt this a little bit for our surgeons from Europe, from Asia, from South America, for the ones that are in private practice as opposed to academics. But traditionally, the family doctors were the ones who referred patients to us. Some of the groups did advertisements out there, whether they were advertisements in our medical journals, advertisements in the local newspaper, maybe even television spots. But then our patients, word of mouth, and we all talk about our patients telling the neighbor that we did well. But the last one, which is kind of snuck in, is the internet. And where social media and branding has become more and more prominent, particularly in this country, is the use of the internet. So these are the 25 most popular social media platforms. And when I got this list, there's some of them that I've never heard of, but I was staggered by the number of people that are on the various platforms. So you've almost got 3 billion people on Facebook. YouTube has a similar number. It's interesting, the dynamics and these numbers change. And what's good now and what's good in 2 years' time changes very quickly. So it's a very dynamic state in terms of which platform of social media is the popular one. Some of those, for example, the ones in China aren't necessarily available in the US. So there is a little bit of region specificity to it. As a spine surgeon, this is how I kind of break things down. And I don't know if any of you have had the pleasure of going to Walmart in the US, but Facebook and Twitter to a little bit of an extent is like going to Walmart. And by that, you're going to meet a wide demographic of people in there. You may or may not like what they look like, what they have to say. And Facebook and Twitter are definitely that. And an easy way to start a colorful conversation is just put up a post and say we should be wearing masks for COVID on Twitter or Facebook, and instantly you'll have 100 voices chiming in on you. Instagram is more pictures, and I apologize if for those of you who already know this, and our kids love Instagram, less political, more pictures that are just coming through. YouTube, longer videos, and they can go up to half an hour. It's amazing, sometimes I'm taking out old hardware, and I had to take out USS hardware on a patient, and so I typed it in, and lo and behold, a surgeon has put the technique of removing USS hardware on YouTube, and gave it point by point what you need to take it out. Now we get into the other couple, TikTok. TikTok is kind of the fad at the moment. They're short videos. They can be 15 seconds, 30 seconds, 90 seconds. It helps if you can dance for TikTok. But TikTok's certainly becoming more prominent, and I would challenge you that TikTok is probably going to get bigger than Facebook just because they're short videos as well. Twitter, 150 characters. You can put a picture on it, quick comments in a picture. Probably it's going to be interesting to see what happens with Twitter as Elon Musk acquires it or doesn't acquire it. But Twitter is short messages. The last one I mentioned is LinkedIn, and hopefully most of you have a profile on LinkedIn. It's a little bit more professional. And again, the description of LinkedIn has been given as drinks after work with colleagues. So hopefully you'll come to the reception tonight and tomorrow night. And it's a similar sort of a little bit more dignified, a little bit more respectful, and usually professional colleagues that you're talking to as well. So why do we do it? And I think this is a question that your age demographic and where you are in your practice probably changes the answer. And it'll be interesting to see what our panelists have to say. The obvious one is to get referrals. Now, it doesn't really matter if you're in an academic position where the institution get referrals, but if you're in private practice, referrals are important. I put the highlighted ones because I think that the underlined ones are the ones that have happened, fame and ego. And more and more, particularly our younger generation, wants to have a presence out there. And we don't have spine influencers yet, but I think the day is coming when we're going to have spine surgeons who are influencers in social media. Branding, we'll come to that. And branding is a very specific sort of thing that I'll touch on. Education and inform, and I would suggest that if you're an academic institution, that's probably one of the goals. Money, well, unless you're getting a lot of likes and followers on something like YouTube, money's not going to do it for you. Interesting one, more accessible than meetings. It's actually quicker to put a case up on LinkedIn or Facebook or Twitter that's interesting without having to submit it to a journal and go through the whole process of it. So a lot of physicians find it's easier to put up their interesting cases on social media for discussion. Part of being a millennial, I mean, social media, a show of hands, how many of you have social media accounts for yourselves? So quite a few, about half the audience is there. I think everyone under the age of 25, 18 to 25, probably has a gamut of these social media accounts. So there's a whole reason why people do this. So what's branding? Brand is a name, a symbol, or a mark associated with a product or service to which buyers attach psychological meanings. And the purpose of it is to gain a customer, gain a patient. When we look at marketing in the traditional sense, we need a target, and that's usually our patients. We need a category. Well, it's easy for us, it's spine surgery. We need a point of differentiation, and that's where it gets challenging because we're all good in this room, but we've got to show that we're better than the person in the next office in terms of acquiring those patients. For us, specifically as spine surgeons, our definition is what do we offer, what's our reputation, what's the message we're trying to send, how do we want the world to see us, what makes us different from other surgeons, and how do we get the message out? And I think this is the essence of developing a brand as a spine surgeon. May not be so important if you're in academics. If you're in academics and you're working at the Mayo Clinic, well, you don't need a brand. You already got the brand there. You're a surgeon at the Mayo Clinic. But if you're in Reno, Nevada, and you're in private practice, you need a brand. Patients need to be able to tell who you are from the surgeon down the street as well. So the point of differentiation becomes really important in developing this brand. This is my background. So I was in academics for 5 years. I've been in private practice for about 20 years. I have a pretty big presence on LinkedIn, and I post some scandalous things on there that I'll talk to you. As part of my MBA, we were encouraged to personal brand and develop a blog, and I'll show you a little bit of that in a second. These are the sort of things that, rightly or wrongly, I've posted. So if you look on the top left, there's a nice card from a patient who's grateful for the care. The top right, I joined a new group, so that's an announcement. The bottom right, just like today, giving a presentation. The one in the middle, maybe not quite as appropriate as the other three, but different things that I've posted in there just to give my own message out there. I post cases occasionally, and on LinkedIn, again, it's a little bit more professional. If you have a difficult case or a good outcome and you want to put it up for discussion, it's a reasonable forum. And I do this, some of it's showing off, some of it's saying, hey, look what I did. Some of it is education as well. The interesting thing is the post that got the most views was this one, and it's a pretty straightforward case of a patient with a central cord injury, myelopathy, some stenosis. What was interesting was I didn't get paid for it, and that's a unique American problem that this patient's insurance, which was a state insurance, was through California. The patient had surgery in Nevada. I canceled my clinic. I did the surgery. People were astounded that private practice surgeons were doing cases for nothing. And it went viral and had 300,000 views and comments about this particular case. And the vast majority were the general public who were surprised that surgeons do cases for nothing. that we don't get paid for doing cases necessarily. So different things that you'll see along the way. I did a blog along the way, and this is where, again, it gets a little bit off mainstream. A bunch of different topics. Started off very rationally looking at the American healthcare system and what's wrong with it, then started getting down to, what makes a good patient, what makes a good physician. Don't have back surgery in the middle, which I encourage you to read, and whatnot. This post last year I put up, and I did it for a couple of reasons. Number one, I don't have a financial interest in any of the robot systems out there. And I used the robots and I went, what the heck? This is not a robot. This is a flexible guidance arm. And I'm still drilling, I'm still tapping, I'm still putting the screw in. So I wrote this blog and posted it. Incredibly thoughtful comments from surgeons out there about this. And again, sending a message out there as well. So the mandate that Norm gave us was academic versus private practice. The goals, institutions, promotion of the institution is the goal. Promotion of the group is the goal. Introduction of new faculty is what the institutions try to do. Highlight new procedures, group goals, and recognition of the entity. And we all know this. This is what academic institutions go. This is what individuals are doing. We're trying to get direct referrals. We might be working for our ego, fame, recognition, and there may be a financial gain to it. Maybe not in number of views, maybe in referrals along the way. So there is a little bit of dichotomy between what the institution wants and what the individual wants. This is what you don't want to see. And some of these are from Australia, some of these are from the US. This is the sort of thing that
the woman known as Dr. Booty, infamous
TikTok,
for dancing and singing around her
and this is a
sedated
cosmetic
patients,
surgeon.
isn't operating anymore.
And
okay, ladies, now let's join Sexy Nation.
When Del Boutte agreed to give up her medical license for at least 2.5 years. But those questionable
so I'll let that soak in for a second. That's not what you want. And unfortunately that happens. And so it's unfiltered and there's no peer review on any of this. So here's our challenges with social media. Number one, how do we avoid tacky infomercials? Number two, nothing is peer reviewed. You can put up whatever case and say you've got 2 years follow-up and there's no validation of what we put up there. Number three, we've got to avoid disparagement, criticism of colleagues, say it in a way that the colleagues are not offended. Number four, we don't want to violate confidentiality when we put our imaging up. Resist the temptation to put the case you just did up on social media. The patient may work it out. And I come back to, if you're going to use social media, you have to be credible, you have to be ethical, and you have to be honorable, which all of us strive to do in our daily lives. You want to avoid divisive comments, and you'll see cases, and I see cases by surgeons that I would never do, and I try to pull something out of that case and make some positive comment and say, well, we probably would have done this, but the patient did well, and go from there. Try to avoid giving individual advice to patients. So if a patient specifically asks you, and particularly in North America, there are medical legal issues involved with giving advice to patients over the internet when you haven't actually seen them. That last one is really important. The internet is forever. And when you get time, there was an old cartoon show with a dog and a professor, and they used to go back in a time machine, and it was called the Wayback Machine. So everything on the internet is archived. And when you get bored, go back to one of the websites where you may have worked in the past and type in the year you were there on this site, and that complete website will appear, and you can browse the whole thing. So anything that you put on the internet is forever. And I can't say that enough, that it's all archived and it's all readily accessible. And it's very sobering when you go back to where you were a resident and you can pull that website out and see your picture as a resident there as well. So my suggestions, number one, insert a disclaimer. Opinions of my own, these are not of the place that I work, and make that front and center so that everybody knows that, that these are your opinions, not necessarily institution. Never post anything you would not like your employer to see. And that's really important. Whether you're in academics, whether you're in private practice, there'll be challenges that our panel talk about in terms of academics and getting approval. But if you don't think your employer is going to like it, don't post it. Avoid patient identification. This is a hard one. Avoid criticism. The skill sets of surgeons across the world are different. Everybody's doing the best they can. And it's very easy with every resource that you or I may have to criticize what another surgeon is doing, and resist that. Avoid inflammatory, defamatory, racist, elitist comments in there, and be polite credible and factual. Avoid sensationalism and avoid being an infomercial. Stay in your lane, and this is a hard one. You know, we're spine surgeons number one, we're physicians number two. Maybe the order is different. Maybe we're physicians number one and spine surgeons number two. I'm not a politician, and so if I'm going to make a comment, I'll comment as a physician or a spine surgeon. If you're interested in developing your brand, Google yourself, find out what there is about you, find all your profiles. In the US, we get rated like restaurants at multiple sites, and you can own those sites and make sure your picture's there and make sure your telephone number's there. And again, respect privacy when you're doing that as well. The goal of all social media as a professional is to funnel to your website. Your website has your telephone. They can contact you. If it's not regularly updated, it kind of dies, so contact is king. Everything's got to work on a phone. It's got to be 19 by 6 dimensions. If it's not mobile friendly, it's not going to work. Be professional. Don't be disparaging, and be consistent in what you're saying as well. So to conclude, before we throw it open to you guys to hopefully criticize the hell out of what I've just said, again, academic versus private practice, doesn't matter where we work, we always have a boss. And I have a boss. I've been called up occasionally and told, oh, that was an inappropriate post, and it's usually something political. But there should be a synergy between the goals of the institution and your personal goals, and I think that's achievable. And I think if you're nice, honest, honorable, non-judgmental, then you're on a winner. You want to avoid infomercials. You want to stay in your lane. And again, I come back to the last 2 points, which I'll hammer again on social media. Number one, the internet is forever. What you post on the internet is going to stay. And there is a catch to that, which we'll talk about in the questions. And number two, your employer is always watching. So if you're going to post something, don't think that your peers, your employer, are not going to see that. And so think about what you're going to post as though you were showing it to them before you posted it as well. Thank you very much. I will
Come up.
I'll come over.
Thanks, Lally.
By the way, that's Reno, Nevada, which is an hour from here. Much nicer city than Vegas. Has mountains and Lake Tahoe.